manage the complexities of this fight. I'll just get everybody on the left-hand side of the room over here just to be quiet just for a second. We have a very special guest. I'm trying to introduce them. I know we're all having a great time, but these amazing people that have donated their time to come up and share their journeys with us certainly deserve the respect from everybody in the room. Thank you, ladies and gentlemen. Our next speaker is a medical practitioner from Pymble Grove Medical Centre. He was early to the fight against AIDS and has now been treating Lyme-like diseases for many years. He is in such demand that he's only taking on new patients under the age of 25. To give us a medical point of view, please, ladies and gentlemen, welcome to the stage, Richard Schloeffel.
And the most gracious thing that I've found tonight is about 20 of my patients here, and they're actually reasonably well, which is fantastic to see. But you know, there's thousands of people out there in Australia with Lyme-like illnesses. So I'm going to give you a little story, a little bit about me, how I got into this. But the main thing I want to talk about is the patients, because they need help. They're actually some of them are extremely unwell, and some of them are dying. So my experience goes back 40 years. So I worked in Papua New Guinea in the 1970s, and I was a young doc, 23. My colleague who was with me is here tonight. And we saw tuberculosis, we saw leprosy, we saw kuru, all sorts of strange illnesses and these people were incredibly sick. And the standard treatment, especially for the TB and the leprosy patients, was 2 to 5 years intensive rotational antibiotics, and some of these patients got well. Lots of them got well, and I went back there 15 years later, and many of those wards were closed where the tuberculosis wards were. So I started this interest in chronic illness, and in the 80s I was seeing the first AIDS patients in the early 80s. Didn't know what it was, all these people with funny bugs, and I got an interest in chronic fatigue syndrome. Now, chronic fatigue syndrome is nothing to do with fatigue. It's a catastrophic, devastating, bone-crunching fatigue with about 1,000 other symptoms that people can't live a life. They struggle from one to get out of bed, to go to the bathroom and back again. They don't have relationships, they don't have, they don't finish school. If I'm seeing young ones, they don't have a life. And many of them spend years, 20, 30, 40 years, totally disabled. So I had an interest in these patients, and around about 1990, I changed my whole focus into chronic and complex disorders. And for the last 20 years, I've been focusing on chronic fatigue syndrome, complex disorders, and borreliosis, Lyme disease. And I thank my colleague Bernie Hudson, who sent me my first, and then half a dozen or so chronic Lyme patients, whatever that was. And I started to work with these people, but they weren't like anybody else. Really complex, really sick, devastatingly unwell, with a whole range of symptoms that didn't make sense. And my colleagues out there in Dickhead land, which I like that comment because it's actually true, there's probably only 1%, 2% of Australian doctors who actually have any interest in this, and most are what we call Lyme deniers. And it creates what I call medical abuse syndrome. Because if you're a patient with Lyme disease or chronic fatigue syndrome for that matter, you get abandoned. So people actually lose their lives, lose any sense of help, and many of them will be permanently unwell, and some of them will die without even a proper diagnosis. So I started this journey some 20 years ago, and now that's all I do. I treat chronic complex disorders, and currently we have about 400 patients in our clinic with chronic Lyme disease, borreliosis, and hundreds more trying to get in and asking for answers. So I want to give you a little outline of what this illness means. Now, most people I see who get Lyme disease, whatever that is, or Lyme-like illness, get it overseas. So you get it in Europe, you get it when you go to Bali on a holiday, you get it somewhere if you're in America, and you come back, and because you cross the border, come back to Sydney Airport, Lyme disease does not exist in Australia. So if you're lucky to find someone who will do a test for you, the test will be negative, because we're doing the wrong tests. So automatically we've wiped out the whole diagnostic criteria for diagnosing someone who's got this devastating disorder. And often the people I see, and some of the Lyme Disease Association in Australia tells me it takes an average patient with Lyme disease 6.5 years before they get a diagnosis. Now, my GP's out at Pittwater, you know, that area, anyone gets a tick bite, they're on antibiotics for 3 to 6 weeks, automatically. Because we know that there's a Lyme-like illness out in that area. So I don't see many patients from there anymore. I see a few, but not many. But the rest of my patients come from all over Australia. And the most common referral system is from other doctors. So professors of other sorts of medicine, professors of surgery, doctors who are GPs working in the coalface. They send me these patients already diagnosed with a European or American test. These patients are profoundly unwell, and I'll go through a few symptoms in a minute. And they get to me, and then I set about a process that's going to take me 2 to 5 years to get them better. And that might sound a hell of a long time, but remember they've already been sick sometimes for 5 years, 10 years, 20 years. And these people are really sick. So they come in their wheelchairs, they're having seizures, they're often paralysed, they've got severe neuropathic pain. That means pain all through their nervous system. Difficulty swallowing, sore throat, swollen glands, headaches, cough, palpitation, pops. They often come in, they can't stand up because their blood pressure drops. The bowel doesn't work, they can't sleep. They have frequency of urination, disturbed periods, severe muscle pain, fasciculations, which are big twitches in the muscles, wasting away, and they're told they've got conversion disorder, which means they're banging it on. There's nothing wrong with you, your tests are normal. So these patients come in with this sort of 20, 30 other doctors into my practice. Now, that's a travesty of medicine. You know, medicine actually is something that, you know, when I trained, it was observation. It wasn't evidence-based medicine. The evidence follows the observation. If you see something that's new, it's called an evolving illness. And what we're actually seeing now is this evolving illness being neglected because it doesn't fit the evidence. And the trouble is the evidence is wrong. So the reason we're meeting here today, I met Carl McManus. I know Moella very well. And this was a painful process for this family to go through. But I can tell you I've lost 20 other patients like Carl McManus. I lose 1 or 2 every 3 or 4 months. Some of them are only 20. You know, I've got 2 or 3 at the moment who don't stop seizuring for 23 hours a day. And they're told they've got conversion disorder. They have a tick bite or a lice bite. I don't believe these infections just come from ticks, they come from lice. And if you come from barley or somewhere, it could be bed bugs. So I've seen all these presentations, all these things that bite, causing this infection, and it's not diagnosed as Lyme because the test is wrong. So this ELISA test that Dr. Johnson talked about earlier, they're a waste of time. Our research at Sydney Uni shows that they're all negative. As soon as we start doing more appropriate testing, we start to make this diagnosis. So we've got all these people who are really sick, not properly diagnosed, and therefore they never get the proper treatment. And treatment is something that is very hard to get. If you're a Lyme patient in Australia, you're very lucky to have a Lyme literate doctor who wants to take you on. Then you've got the medical boards, the other doctors, and everyone criticising you because you're making a stand. Now, I'm Where's Wally? If you ever watch television programs on Lyme disease, you'll see my head popping up now and then and making comments and having this discussion. Then you'll see someone criticising what I'm saying, oh, it's not true, all those labs who do the tests overseas, they're all just after the money. This is all nonsense. The labs that do tests for Lyme disease overseas are accredited by their governments, by their state governments, their federal governments, whether it's Hygienics or Infectolab or any of these labs, and they're coming up with positive tests or suggestive tests that people have a Lyme-like illness or a co-infection. And I believe them. And then they respond to treatment. But the treatment doesn't take 6 weeks, 6 months, it takes 1 year, 2 years, 3 years in some cases. And I've seen some of my patients here tonight who came in their wheelchairs, totally disabled, totally unwell, and are now well. Now they're very fortunate because they came to a Lyme literate clinic where we were able to manage them. This should be mainstream. This is not a disease that we can ignore. Peter Irwin, I spoke to him a couple of weeks ago and congratulated him about finding one Borrelia in one tick on one echidna. Now that's groundbreaking. because everyone's been saying this germ is not here, it's here. I know it's here because I see it every day. People tell me, I've never been out of Australia, I've got a tick bite, I'm sick. They have seizures and fits and they're trembling and Parkinson's and all this sort of stuff. They have positive tests from overseas and they have positive tests here from non-NATA approved labs. So there's a lot of politicalisation of this condition, but ultimately we need to turn it around for the patient. This is not about those of us who are well, it's about the carers, the patients, and the thousands of you who get tick bites or things that bite that are going to make you sick. And if we don't get on top of it now, we have a devastating problem happening out there in GP land, and basically we have very little specialist support. And Bernie and there's a couple of other infectious diseases specialists know about this disorder, but generally what we're not getting is the support of the science. Now, the reason we're here tonight is to raise funds for the Carl McManus Foundation, because that funds some of the research we're doing through Sydney Uni, and already we've started to move towards to look for a test for the Borrelia that we found in the tick, one tick, because that could explain things. We might have a whole range of these germs, all different types, all different sorts of infections that are making people sick, and we haven't got any tests for them. At least in Europe and America there are tests. So the funding and the money we basically make from this goes to the research, because the research is paramount, and then we might change the thought process of the doctors who are doubting this and saying that if you've got a disease that you can't explain, you mustn't have the disease. And that's very poor medicine. That's extremely poor medicine. And I think eventually this will be seen as a time of travesty in medicine, because the people who die and the people who don't get treated properly suffer. Their carers, their families suffer, and eventually, you know, everyone will know someone who's got a Lyme-like illness or Lyme disease. Now, if we have to get to that stage before we start treating it, that didn't happen with HIV. That doesn't happen with TB. You know, it didn't happen with syphilis once we realised what it was. So there's a whole politicalisation here that can only change by the science being improved and people like me teaching the other docs what to do. I've worked out what to do. I think I know how to treat maybe 80 or 90% of these patients and get it better. And that's much better than most people, but I've been doing it for 20 years. But how many Lyme literate doctors here? And there's probably about 10 of us or 15 here, and I'd say there's probably 20 in Australia, 25 doctors who deal with it. And we might have thousands of patients. So the more research funding, the more research we do, the better tests we have here, the greater chance we have of at least making a diagnosis and then setting about this long, difficult process of treating people. And it isn't just giving them antibiotics, it's all sorts of intravenous therapies, it's a whole change in diet, lifestyle management, psychological management, then rehabilitation. It's a long, slow process to get someone to become well again once they've been misdiagnosed or not diagnosed or conversion disorder diagnosed for 6 to 10 years. So, you know, I've had my say, so thank you for being here. Recognise this illness is a devastating illness, and if any of you are carers or patients of this illness, I'm sure you can vouch for that. But have a look at some of the videos online and what's happening to people. If you come to my surgery, you would see people in wheelchairs. You'll see people seizuring all day. I've got beds with people having fits and all sorts of things that I deal with every day and my team deals with. And they're coming from all over Australia. And I think that's probably happening 50-fold out there in the rest of Australia. So we're just scratching the surface. But what you donate here, what you fund for our research will change people's lives well into the future. Thank you.